Good morning, everyone, and welcome to the 2022 North Country Leadership Summit, Optimizing Healthcare, Community Collaboration, and Workforce Resiliency. This is day 4 of the Leadership Summit. My name is Andrea, and I'm with Adirondack Health Institute. Welcome, everyone. I'd like to give a thank you to our sponsors. Without them, we would not be able to host such a successful event, so thank you for your continued support. And some housekeeping items. Please place your questions and comments in the chat. Staff will ensure that your questions are answered during the Q&A portions of the session. All attendees were asking to remain muted with videos off during the presentation. And all presentations will be recorded and archived on the North Country Leadership Summit webpage, and that will be available within the next couple of weeks. I would like to now introduce Mary McLaughlin. She's the director of the North Country Care Coordination Collaborative, or the NCCCC, as some of you may know. And Mary is going to facilitate today's presentation along with panelists who she will introduce.
Mary, I think you're still on mute.
Sorry about that. Let's take a mulligan for you golfers out there. All right, so thank you and welcome. I'm glad you guys could make it today. And also thank you to Andrea and Sarah and Nancy for all the work they've been doing on the summit. It's been great. There's still a day and a half, so stay tuned. So what we're going to be talking about today is the North Country Care Coordination Collaborative and some of the work we've been doing. This is really about connecting the dots of existing resources in the region, sort of building blocks. And the real goal is not to give you a summary of the grant, although obviously that will be part of it. But the real goal is to help spread the adoption of these best practices across the region so that a client, no matter where they came in the North Country, would all get the best possible solutions for their issues. So UVM, CVPH received this HRSA grant on behalf of the region. It's being administered both for administrative support and executive sponsorship through the Adirondacks ACO, and I'm the project director and I work for AHI. So it's been a collaborative since the very beginning. Even the structure of it is collaborative. Let's see, how do I make this go to the next slide? Okay. So today we're having a panel. Everyone will give a little more information about themselves as they speak, but I'll just let you know that Kelly Owens, who's the executive director for Mohawk, Hudson, Ahec, is speaking. Ashleigh McGowan, the VP for Strategic Development from Health Workforce New York. Colin Duell, who is a pharmacist from Hartford Healthcare, but also previously was a student at the Albany School of Pharmacy. Julia Prusik, who's a manager of project development at Hixny. And then I'm your moderator, Mary McLaughlin from AHI. So a couple of guidelines for the meeting today. Please ask questions as we go along. Because it's a panel and we're having different discussions, we want people to be comfortable to just put in the chat any questions you have, and either Sarah or Andrea or myself will make sure that they get addressed. And again, I just want to emphasize, be thinking about how this may apply to your organization and how we could spread these kinds of practices across the region. Certainly reach out after for any further discussion or thoughts or interest in the projects. And thanks again for joining us today. Sorry, I don't know why this isn't exactly working. Okay, so the collaborative was really based on a history of collaboration across the region over 3 decades. And I bring that up because part of being a HRSA grant, it's very interesting that you get to meet other grantees across the country. And what we found was we are really ahead of the game in terms of our ability to collaborate and people willing to come to the table and work together to improve patient care and population health. And this gives a lot of detail here, what I have in front of you, but what it's really describing is that, 3 decades ago, a primary care consortium started. That kind of morphed into a Medicare shared savings program, which morphed into the Adirondacks ACO. The health home, Medicaid health home was formed during that time, all collaborations between multiple partners in the North Country. Then, of course, the DSRIP work collaboration was the name of the game there. The Northwinds IPA was set up as the behavioral health arm of the contracting work for the region. And then there was a group that was meeting to do some planning for DSRIP 2.0 called the North Country, the North Country Improvement Project. I think that was what NCIP stood for. And there was a subgroup of care managers. That's sort of how we ended up applying for the HRSA workforce grant for the region, focused on care management. And then it was awarded at the beginning of the pandemic. So that subgroup just continued and then grew into this collaborative. And then we recently received the a HRSA workforce grant that's focused on retention, recruitment, and increased training and apprenticeships for care managers. And that grant is just starting. So that'll be a nice springboard off of what we're doing here. We also, of course, have the 1115 waiver, which is coming into play hopefully soon. That's been submitted by New York State to CMS. So just to get a sense of the audience, can you just show me who is familiar with the North Country CCC or North Country Too Many Cs, or this HRSA grant that I'm talking about?
Mary.
Andrea.
Mary,
Yeah.
Sarah and I are not able to open the polls. We've been behind the scenes trying to open it. We can't. So perhaps if people could just write into the chat,
Okay.
if you are familiar with the NCCCC, yes or no?
Okay. Let me just see if I can see the. You're gonna have to tell me because as
you're good.
As
There's a couple people. Most of them are no's. I see 3 yeses so far. Oh, 4, 5. I would say it's like 5 to 10 yeses. 5 yeses, 10 no's.
Okay. All right. So then that's good. I will explain a little bit about the grant itself so you get a feel. I just wanted to know what we had out there. So thank you for doing that. So in terms of this particular grant, the focus is on transitions of care out of the 5 hospitals in the 6-county region. So the 5 hospitals are CVPH, Adirondack Medical Center, Elizabethtown, Alice Hyde, and Glens Falls Hospital. So we were focused on using care management to improve transitions for high-risk individuals. So the first goal was to create the collaborative, which I think I teed up that the history in the region really helped us build that collaborative, and it grew while we were meeting over the last 2 years. It's a 3-year grant. We have 1 more year. We just started our 3rd year here this month. We created and implemented best practice protocols by basically listening to areas of the region that were doing a really good job in certain things that they felt were best practices, sharing them, then figuring out, okay, how do we make sure that everyone in the North Country uses that strategy? So a subgroup would meet and figure out how to use that strategy. And we'll talk a little more in detail about what some of that looked like. The 4th goal was related to communication and sharing a risk score regarding care management. We were originally going to do that through asking providers, our partners, to give us the patient's risk score and somehow try to mesh that all together. And we realized that would just be like a mosh pit mess. So we decided, Hixny, who's been a fabulous partner, said, you know, we have all this data, chronic conditions, hospital utilization, social determinants of health. They have those problem lists and so forth. So we were able to make that happen, which is just super exciting. And Julia will talk a little bit more about that. And then we had quite a bit of work related to care management, workforce development, and Kelly, Ashleigh, and Colin will speak a little bit more about that. So to give you a sense, there's 31 organizations that are part of the North Country CCC, and they cover, you know, the hospitals, primary care, mental health, substance use, community-based organizations, county organizations, managed care organizations, conveners like the ACO, IPA, Northwinds IPA. Am I giving you enough letters? Everybody doing okay with that? Let me know if I blew that with all the letters. But the idea is it's a lot of people across the region, and they're really willing to come to the table, even in the middle of a pandemic, and even maybe worse, even in the middle of the workforce crisis that is occurring now as a result of the pandemic. So people are committed and willing and want to work together. We have 50 collaborative members, 6 counties, 5 hospitals. During the first 18 months, we met twice a month. And as I said, people came to the table. Now we're meeting about once a month, now that we've kind of, a lot of the subgroups are moving along and we don't need to meet as frequently. So it's been very effective. We did several surveys. Kelly will describe some of the priorities that were identified by frontline care managers in the region and the sort of bag of tricks open forums we've had for care managers, what they've been about. We had 38 best practice presentations from partners across the region so that we could share what was working well, and again, try to spread that so that it, you know, just because you live in Franklin County, you get something better than if you live in Clinton or Warren. That's not, you know, we're trying to make it equitable and have adoption throughout the region. The other space that we really explored is data. Of course, it's a HRSA grant. We have to measure success. If you're working in population health, that's required. And in the past, I think we've done a lot of asking partners for data. And what we decided was to really focus on trying to use the larger central data warehouses that exist in the region and maximize their use. So Hixny, again, great partner, a lot of good data coming out of Hixny with many of the measures. Psyches is a Office for Mental Health tool for quality management, and the IPA has been able to gather some aggregate data on measures there. ACO has a wonderful claims data set that they get information from most of our payers, most of our managed care organizations. And so they have been building a clinical data warehouse in partnership with Hixny, and that has been very powerful to really identify opportunities in population health and then measure success. So just getting used to using that data and cleaning the data and making sure it is what we think it is has been very useful and has teed up a lot of good information for the future. So we have 17 measures, most of them are HEDIS measures. Some of them are process measures, but they are being reported to HRSA. So in the 3 major categories of goals, communication and workforce and best practice, the things that we've been able to implement are the risk flag, which is available right now in Hixny in the snapshot, where you can see high and at risk clients identified. And certainly Julia will speak more in depth to that. We've tried to improve the interfaces to Hixny, mostly around social determinants of health. One of the major activities that we still haven't implemented, but I'm really hoping we can get somewhere with, is having the care management agency and program be visible in Hixny. Like I always like to say, about 10 or 12 years ago, if you wanted to know who the primary care physician was, you might have trouble finding that out. Right? But now that's pretty simple. I mean, it doesn't work 100% of the time. I get that, but it works way better than it did. We'd really like to see that if a provider wanted to know, is a care management agency involved in this case, that it would be easier to figure that out. So we're advocating with the Department of Health. The Health Home and the Health Home Coalition has been very helpful in that partnership, and also with managed care organizations to try to get that information into Hixny so it's easier to visualize for providers. And I spoke about the ACO's data warehouse. Kelly and Colin and Ashleigh will speak about some of the workforce initiatives in more depth over the next bit of time here. In terms of some of the best practice protocols that we've focused on, of course, always trying to make sure a high-risk individual has a referral to a care manager in the region. And then, you know, the bread and butter of making sure the primary care and behavioral health provider had see the client within 7 days after discharge is something we've tried to emphasize. For Medicare clients, the resources around care management services is more limited because it's not funded through Medicare generally, only a small portion is. So really trying to leverage the primary care office, care management services, and Office for the Aging. We had one county whose Office of the Aging was really doing a great job connecting for care management for their clients. And we were able to share that information so that every county, the care managers are more aware of how to utilize that resource. For Medicaid populations, trying to assure that the resources are utilized. So Health Home, the nursing home diversion and TBI waiver programs, the managed long-term care service programs. So trying to just share this information that these resources are out there and available and sometimes underutilized. Utilizing the managed care organizations, which have significant care management services. So partnering with them. Fidelis has been a partner since the beginning, and MVP just joined us, and they have been strong partners and willing to collaborate and work with us to try to figure out how to better leverage that resource. The chronic condition self-management and Alzheimer's programs are excellent programs that are also underutilized, so trying to share information on that. Using 80K Wellness Connection for resources and a closed loop referral system for where are the resources in each county. Substance use warm handoff. This was something that Glens Falls Hospital did a really good job at. They had a substance use provider come to the bedside in the hospital for anyone who had a substance use contributing factor to their admission. And we were able to implement something similar in all 5 hospitals because what Glens Falls identified was that that improves a client's likelihood of getting treatment. So now that exists in all 5 hospitals, either using hospital staff or a peer from the community or using an app that some of the organizations have been able to leverage. And then the final thing was that CVPH, they had a program in using a peer organization, NAMI, in their emergency room. They partnered on that, and they would be able to address social determinants of health using that resource. So we've set that up in 4 at this point of the 5 hospitals. So really making progress in these kinds of areas by spreading this kinds of practice. Everybody doing okay? Any questions or anything? You all right? So we're going to hand off to some of our other panelists now. What I really want to emphasize is that this is not just a grand summary. I really want us to try to be thinking about how we can spread and adapt these strategies across the region. So next up is Kelly Owens. She is going to share some information about workforce.
Thanks, Mary. You actually can go right on to the next slide. So again, my name is Kelly Owens. I am the Executive Director at Hudson, Mohawk, Ahec, and a little background, I was the Workforce Coordinator and Interim Center Director from 2009 to 2015. I was a Workforce Manager at AHI during the district years, and then I just recently returned back to Hudson, Mohawk, Ahec in 2021 as the Executive Director. and really excited to be back and excited to share some of the collaborations and partnerships through the NCCCC. Some additional information about Hudson Mohawk Ahec. We have 4 primary areas. So with pipeline development, we look at classroom presentations, try to incorporate hands-on activities. We have summer MASH camps. We had 3 camps actually this past summer with hands-on activities and simulation exercises. We can assist with job shadows for students who may have interest in any healthcare careers. Experiential opportunities, we can assist with clinical rotations, so linking students to sites and sites to students if folks are interested in clinical rotations. We also have an Ahec Scholars Program, which is a college internship program. It's 2 years where college students can receive a stipend each year. So we're highly promoting that as an excellent opportunity for college students to earn some money and get some extra experience while they're in college. Continuing education, which is a lot of what we'll be discussing today, and how we assisted with NCCCC and providing some additional training. And then opioid prevention and education. We have an RCORP grant that covers Fulton and Essex counties. And then we have another grant, Opioid Prevention and Education Program, or OPEP for another acronym, that covers all 10 of our counties. And that looks at prevention, education, treatment, and recovery. So now on to NCCCC, and we have another polling question. So, and this will relate to a little bit of what I'm sharing and a little bit later of what Ashleigh's sharing. But would you be interested in an online one-stop shopping website for available trainings? And would that be helpful for you and your staff?
So if everyone could just put yes or no into the chat, that would be great. So far, we're seeing a couple of yeses. Oh, a lot of yeses coming through.
Excellent. Well, this is the right presentation to be in because we're going to show you a lot more information about that. So moving on to the next slide and talking about the NCCCC training subgroup. When I returned to Hudson Mohawk Ahec, I began working with the training subgroup along with several other partners. And it's been a really great opportunity to kind of build on collaboration. We discussed the survey, and rather than just a group of us sitting around the table identifying what kind of training staff needed, we did indicate that the survey needed. We needed to hear from frontline staff what they felt was necessary. And initially, we target specific training topics such as motivational interviewing, trauma, trauma-informed care, but then realized that there were different core differences between several different groups. We had care managers that had been in the role for a very long time and were very experienced. We had those that were in similar roles, but were slightly different, such as discharge planners, and then also new care managers who needed onboarding and orientation as well. So the survey really morphed from identifying strategies, more from specific trainings to identifying strategies that would make care managers feel more comfortable in their role. And then looking at the survey, it was developed to help identify the knowledge gaps and also addressing the challenges of a sustainable workforce, specifically for care managers. So we had care managers identify what agency they were from, identify the most challenging aspects of their job, rank the topics for regularly scheduled training of what was important to them, and then an opportunity to share best practices as well. We were really excited with the number of responses, having 138 responses from 29 organizations, which really helped build the platform for training, as you'll see, as we talk about the various kinds of training that we develop for care managers. We did include components related to burnout and vicarious trauma, feeling that that was really a tool for retention of our current care management workforce. And then if we look at the key findings, you'll see that managing burnout and vicarious trauma were some of the highly rated topics, along with de-escalation and difficult situations, boundaries for care managers and care coordinators and care delivery, and then also a need for a hub to really host those resources. So whether it was onboarding checklists for new care managers, for community resources that were available, and then looking at what type of training was available, whether it was a live webinar, whether they could register for a live in person, or if it was something that was recorded and they can access as they needed. And then looking at the next slide, So we have made a lot of progress on the findings from the survey. We've had several trainings. So we had addressing burnout and improving well-being back in March, and that was brought to us by Kim Perrone from the Center for Clarity and Compassion and Contentment. We had 56 individuals attend that particular session. We had a session in June, Meeting Resiliency in the Face of Adversity. And that was brought to us by Dr. Aaron Stewart, who is from CVPH, the Assistant Medical Director in the Psychiatry Department. And we had 52 individuals participate in that particular training. We have a training actually scheduled next week, Skills to Calm and De-Escalate Emotionally Dysregulated Patients. And Mary doesn't know this yet, but we already have 132 people registered for that particular training. In the past, we've probably averaged about 80, 85 folks that have registered, and then having attendance of between 50 and 60 was great. So looking at seeing this 132, we've got some pretty high numbers, so that's exciting. And then we have another, so the de-escalation training is actually, I forgot to mention, that Charles O'Donnell, who's a nurse practitioner in psychiatry at Albany Med, will be providing that presentation. Again, all of these have been recorded. So if folks haven't been able to participate live while the sessions are ongoing, you'll hear more about the Health Workforce Collaborative, but the trainings have been put on the collaborative so folks can view at a later date. We're working on the planning for boundaries between care coordination and care delivery. Mary and I have some meetings scheduled with some potential trainers, and that'll take place in December. One of the outcomes of the initial training, addressing burnout, improving well-being, was that people wanted more. People were verbalizing they wanted more during the session, and then even in the evaluations, they wanted more related to burnout and self-care. It was something that was needed at the time. And what was exciting is that even though it was a webinar, or actually it was a meeting, so we could see people. Sometimes cameras were on, cameras were off, but there was a lot of engagement. So whether it was engagement, people taking themselves off mute and speaking freely, or people, if they were in a large room and didn't have that opportunity, would participate by chat. So they were very engaging trainings as well. So based off of the feedback that folks wanted more, we've scheduled monthly sessions related to addressing burnout and improving well-being. We've had 4 sessions held. There was actually a session held just yesterday, and the attendances range from 16. Yesterday was actually our highest. We had 33 individuals attend. The topics have been on transforming stress, mindfulness, self-compassion, resilience. And then we have some additional trainings coming up October through December related to work-life balance, self-care, and then in December we'll have our final session, managing multiple priorities, which I think is timely, given that we're looking at the holiday season as well. And then moving along, so looking at the need to address a hub to host key resources, we have collaborated with Health Workforce Collaborative to host resources, as I mentioned, the checklist, to notify of upcoming trainings, and then to be able to view recorded trainings. In the future, we're anticipating that it will be an opportunity for career seekers to seek training to become a care manager, and also to link with potential employers as well, and an opportunity for employers to link with career seekers. And then one additional collaboration. So in addition to participating in the training subgroup, there was also a training component with the medication management subgroup. So I also participated in that particular group as well. And we did identify there was a need for frontline care management staff to receive some training. Guidance on what they observed with their clients and looking for red flags, like having extra medications, having old or expired medications, or if they're missing doses, they're running out of their medications prior to the renewal. So based on that, we reached out to Albany College of Pharmacy, and we were linked with Colin, who's been fantastic to work with. He's going to share more related to the training that he developed, which is fantastic. But it really has been a great relationship. We think that the tool that he developed is going to be very helpful for care managers. Some folks have seen it to provide some feedback, and are really excited to be able to lay this out and have it be available to the entire care management community. And I think that's it. I know I kind of rushed through. I'm sorry. But if anyone has any questions, you can feel free to put the questions in the chat. Happy to answer. Or if anything comes up along the way, happy to answer as well.
Great, thanks so much, Kelly.
Thank you.
I don't see any questions at this point, but please don't hesitate. So Colin's up next, and he's going to share with us what he some of what he created around medication management training. So take it away, Colin. Thank you.
Thank you for that introduction. It's great to be here this morning. My name is Colin Duell. I'm a pharmacist and new pharmacy resident at Hartford Healthcare in Connecticut, and I recently graduated with my PharmD from Albany College of Pharmacy and Health Sciences. I'm really excited to be here and get this training rolled out. So I created what I'm calling a med management training, and this is just some background and the purpose of why this training was created. Some background, as Kelly had talked about, there was an initial collaboration with my pharmacy school in Albany, and it was created in mind for care managers and home health aides. But with that, I believe that anyone caring for patients can benefit from going through this training. It's pretty immersive. It goes in depth from a pharmacist point of view. So I think that anyone taking care of patients would benefit from going through this. And it also is critical for successful transitions of care, which is what NCCCC is after, transitioning patients between the 5 hospitals in this region. So ultimately, the purpose of this training is to address known issues with medication management in the role of a care manager. All right, the next slide shows an outline of everything that this training encompasses. So I've broken it down into 3 modules. The first module is medication adherence. The second module is medication red flags. And the third module is managing medications in common high-risk disease states. And at the end, I have a summary and additional information. Basically, each module goes through an introduction and background section, which explains why the module is important. And it also ties in some real-world data. I have examples following this, but to make this training specifically pertinent to care management, their goals and roles have been highlighted in each section as well, as you can see. And the main section of each module is the evaluate and assist section, where subtopics are highlighted to guide care managers through questions that they would ask the patient and then are correlated with potential actions to take based on the patient's response. I've also, in each module, came up with a real life case scenario to make it more applicable to real world scenarios. So I'll go through the following slides to give you an example of what this training entails. And if you have any questions, please feel free to interrupt me and ask, or just type it in the chat. So starting off, this is a brief description of what's in module 1. So it starts with an introduction. This is where I explain why medication adherence is important using data from available literature. For example, patients who have suffered from a stroke who maintain high medication adherence have the lowest incidence of adverse outcomes compared to those with moderate or poor medication adherence. And in these slides, I reference literature in the bottom right-hand corner if anyone is more interested or wants to dive a little deeper about the data that's out there. On to the next slide, it discusses contributing factors to non-adherence. So for broader concepts like medication non-adherence, I break them down into either contributing factors or small subsets of that concept, just to make it easier to conceptualize and address each factor in depth in the evaluate and assist sections, which again are the main sections of each module. The next slide shows the goal and role of care managers, specifically in medication adherence, but this is in every module. So I started by outlining the goals and roles of the care manager so that they can generally understand how they fit into the patient's care from a medication management standpoint. For this slide, the goal for medication adherence would be to improve medication adherence to improve health outcomes as shown in the data listed out previously, and then it shows their role and the evaluate why patient are unable to adhere to their medication regimen, and then gives action. So it's kind of broken down specifically into where they fit in this process. On the next slide is an example of an evaluate and assist slide. So for this contributing factor adverse effects under the medication adherence module, it shows you something to keep in mind coming into those situations first. And then it goes into an evaluate section that includes general open-ended questions as well as specific questions to ask the patient, and also includes a rationale of why you're asking these questions. And then it is correlated across the slide to the assist section, where care managers can specifically assist patients based on their responses. I also have included asterisks at the bottom. Oh, sorry.
Sorry.
It's okay. Asterisks at the bottom of the evaluate section, because later on in the presentation I have multiple references. Specifically here, this is about adverse effects of common medications. So it gives you a bunch of common medications and their most commonly seen adverse effects. All right, so moving on, there are cases in each module, at least one. Some of them have 2 or 3, where I use a real world example. So this one is about adverse effects of loop diuretics, specifically furosemide. And it walks you through an example of a 72-year-old woman with this past medical history. This is what's going on at home. What would you do from here as a care manager is basically what I ask. And then on the follow-up slide to this, I have a explanation and the role of the care manager. So I explain the case on the left and what could be wrong with this case, what the patient's voicing, and then on the right, the actions that a care manager can take in a case like this. Outside of cases and the evaluate and assist section on the next slide, I have specifically in some assist sections like this. This is an ideal medication list that patients should have. So I have tactics to benefit patients who have trouble with medication adherence. Those are also included in this training, and this is an example of an ideal medication list, of which I have an example on the next slide. And I also include a template that can be printed out and filled out by the patient and or care manager. So this is an example, and then I also have a template at the end. It's in an Excel sheet. It's easily printable at the end. All right, so that was module 1. And then if we go to module 2, this is all about medication red flags. Another really pertinent topic for care managers. Okay, so this is the background for medication red flags. It follows the same format. Just giving introductory information about medication storage requirements and best practices for storage of controlled substances. And then I have a case on the next slide again. Another example of a case, improper storage of a specific medication called Pradaxa. So it kind of highlights.
Do you guys hear that you're talking? I don't know how to shut that off.
Oh, I can't hear it. I don't know
Okay,
if
it's just me then.
Okay.
No worries.
Okay. All right, so yeah, this is about Pradaxa, and it's just kind of highlighting that specific medications can have specific storage requirements. And then again, on the next slide, I have explanation and role of the care manager. So there's many cases throughout the training that I think are pertinent, and they are based on real life experiences that I've had with patients. Moving along, there is also, this is kind of one of the references that I have about medication drop boxes based on the location. So I've included these counties as well as another slide with other counties in the North Country. So this is really for patients who have been switched from one medication to another or have expired medications. It helps to properly dispose that medication, and care managers can assist the patient by letting them know that these locations are available for medication drop boxes. So that kind of helps assist with medication red flags. Okay, so that was module 2. And in this last module, module 3, I focus on managing medications in common high-risk disease states like diabetes, COPD, asthma, and heart failure. So again, here's an introduction, just outlining certain disease states that are often associated with higher inherent risks, adverse drug events, and detrimental side effects if the medication is not being used properly. So the first one I go through is diabetes. For this module, since somewhat complex disease states are being covered, I include a more detailed introduction explaining some of the pathophysiology behind the disease to better help care managers understand why the medications these patients are taking are prescribed and why they're administered the way that they are. Also, I highlight some of the detriments that may occur if those medications are used incorrectly or they're not adhered to. So that's diabetes. On the next slide, I have a more immersive informational example of the pathophysiology of asthma and COPD, two very common respiratory diseases. And then also as an example on the next slide, I have a chart that I've done for inhalers specifically because there's so many of them and each one has a different administration technique. So care managers will be able to use charts like these to help explain proper administration of specific medications and drug formulations. All right, so I hope you enjoyed an overview of those first three modules. At the end, there's a summary section with some additional materials. This is the slide I was talking about before with commonly utilized drug classes and their most prevalent adverse effects. It's not just this slide. There's two more that follow with different drug classes and their intended effect and common adverse effects. This is the ideal medication template that I was talking about before. You're able to print this out and help the patient fill it out. And then lastly, there is a pharmacological treatment algorithm where it can go awry and how you can assist. So with that, I will entertain any questions, comments, or concerns. Then I also have my personal email here if you have any further questions that you'd like to email me about. Thank you for having me.
All right, thank you very much, Colin. Are there any, I'm sorry about that confusion. I was hearing the video, actually. I don't know what happened there, but I'm glad nobody else was having that problem. But
good.
thank you so much, Colin. Does anyone else have questions? That training is going to be available. Ashleigh is going to speak in a minute about the Health Work Collaborative website, and that video that Colin was describing is available there, and I think would be useful to many of your staff. So I don't see any questions. Did whoever was having trouble with hearing, who lost sound, Sue, are you okay now? Are we all set?
Yes, they redid our Wi-Fi password in the middle of the webinar.
Oh, love it. Technology. It's great. Always our friend. Okay, Ashleigh McGowan from Health Workforce New York will be up next to give you some information about that website and that resource that you can definitely utilize as a one-stop shop for training and other recruitment and retention resources. Okay, Ashleigh.
Perfect. So, hi everyone. I'm Ashleigh McGowan, the VP of Strategic Development for Health Workforce New York. But today I'm actually here as a founding member of the Health Workforce Collaborative Board, and to show you about a product, a tool that we have put together in partnership with NCCCC that's going to help you identify and find the trainings that you're needing in your day-to-day work. So we'll jump to the next slide, Mary. Just to start with a little bit of background on who the Health Workforce Collaborative is. We are a nonprofit. We were formed in 2020, right at the beginning of the year when we realized there was going to be severe funding cuts to health workforce development programs in New York State. And a number of our funding board came together and determined that we needed to come up with a more collaborative statewide solution that you'll see how that fell together. So we now have 10 working board members. It's a nonprofit, but we are board members that are running it and getting it off the ground. And they're comprised of leaders in workforce development, economic development, and HR across New York State. And I'd like to thank our funders who have made it possible to get us where we are today, and look forward to continuing to build and grow the collaborative into its vision. So the next slide highlights the reason that we exist. So there's no shortage of evidence that there is a workforce shortage here, but even back in 2020, before COVID really kind of put that into crisis levels, we knew the workforce challenges were there. And, you know, for the last 10, 20 years, there's been a number of programs and services that have been designed to address those challenges. So when we got the funding cuts in 2020, we really took a deep dive into these 5 external factors that were kind of driving the workforce challenges at that time. So mainly there was no cohesive systemic infrastructure of workforce development in New York State. Those organizations that were receiving funding and doing programs were not coordinating or collaborating with each other. With what career pathways do exist, they're very difficult to identify and even more challenging to navigate once you're in them. Of course, the funding cuts were driving it. We are seeing a lot more workforce funding coming into the state right now, which is fantastic, but we're still not able to access that funding even today with where that crisis levels are. So continuing to keep an eye on that as we move forward and ensuring that it doesn't get cut again in the future is definitely a priority. And then, of course, workforce shortages, I think this would be better represented as pipeline shortages. So not enough people going into health careers in order to fill the gaps that we're seeing today and are going to experience in the future. So in the next slide, we formed the collaborative and really our driving mission that you can read on the screen here. But I just want to highlight the idea that we really had the vision of innovative methods that were truly designed to pool everyone together. The stakeholders that are already doing workforce or in need of workforce development solutions would have a place to collaborate and really address the workforce development challenges in New York State together. So our approach for this, if we go to the next slide, Mary, is the Health Workforce Collaborative Platform. And this is a go-to place for workforce development information, resources, and tools specific to healthcare, and really designed to be that place where the stakeholders can convene. And we're talking from not just the developers, but the training institutions, the employers, and then connecting them and collaborating with as well those that are in need of those solutions. So the career seekers, the training students, and the workforce itself. So the idea you can see is we have a number of tools that are built into this system, and they're truly designed in order to allow those that have programs, services, solutions to be able to share and promote that those exist. And then for those in need, they can come and search and identify or access what's available locally, regionally, or statewide, and then be able to connect with whoever is providing that resource or training. So think of it as a network of databases. It's interactive, it's mobile accessible, and it's truly trying to raise awareness around what already exists so that we can collaborate and ensure that people are accessing the information that's needed. So this tool does exist, and I will jump into it in a minute, but I want to hop into where NCCCC come into this. So if we go to the next slide, Mary. So we started to work with NCCCC. Kelly Owens, who is on our board for the Health Workforce Collaborative, as you heard, was on the training subcommittee for this collaborative for the NCCCC organization. And it was clear that they were having challenges, or I had identified that there was a challenge in New York State for care coordinators or care managers to be able to identify and access trainings that would help them with their profession. So Kelly made the link, and we had a conversation about how we could leverage the tools and resources that already existed in the collaborative platform. And we came up with a dedicated portal that is just for care coordination, care management, trainings, resources, and information. So I'm going to jump into that now and walk you through what that looks like. I'm going to share my screen. Okay, hopefully everyone can see my screen okay. This here is the landing page for the collaborative platform. It's just hwcollab.org. And in order to access the care coordination portal, you'll see that there is a link at the top that says care coordination. I believe we've also shared the link in the chat for you to copy and save. But when you click on here, it takes you to the landing page that allows you to basically access the trainings, the resources, and the information that the NCCCC, as well as others across the state, are populating into the system
and tagging that they are relevant to care coordinators or care managers. So I'll just walk you through this page. Everything is designed and set up to be hopefully self-explanatory and really easy and simple to use, whether you're on a mobile device or your laptop, desktop. So we've got some information at the top that kind of identifies what this page is about, our partnership with NCCCC, and then the links that are accessible for you to quickly jump to a section that's relevant to your needs. But I'll just scroll down. So you'll see first we have find a training. This was the core concept, the core idea. So right away, if you know what training you're looking for, let's say it's burnout, you just type that in. You could filter down further if you wanted to. And then when you click search, it will open up a filtered results from the database that's in the system here. So from there, you can quickly see, or you can filter further to identify a training that is what you're looking for. And from here, we're providing you with access to the information of that training, a direct link to be able to access that training, and as much information as possible for you to be able to know or connect or engage with who is providing that training as well. The goal, again, is to promote these trainings so that you are able to easily access and search for that information. So I'll just go back to our landing page here again. If you aren't quite sure for a specific training and you're just browsing, we've come up with some filters and displayed, kind of pulled some trainings onto the page here that you can see. So upcoming webinars, we've got pre-recorded trainings that have been posted and shared. We've taken some featured trainings that we're kind of highlighting here. So you can see that there is a number of trainings already in the system. We're actively working with training providers, and as trainings are being created, we're making sure that they are uploaded and accessible on here. And we've identified some key categories that you can quickly search. And if at this point you still aren't finding a training that you're looking for, maybe the best approach is to go directly to a training provider. So we've tried to identify who within the state creates these trainings, produces these trainings, that you might want to connect with them directly. And from here, you'll be able to see, if I open up an example of a training provider, so Kelly's organization, Hudson, Mohawk, Ahec, you can learn all about them, you can see what trainings they're offering, and you can contact them directly as well. So you can start to see that networking and collaboration capabilities there too. Still can't find what you're looking for, still hunting for that. We want to know. We are trying to populate this system and make it as valuable as possible to you and to fit your needs. So we have a space here where you can request a training, takes you to a simple form, let us know what you're looking for, and that will help us put it on our radar where we can actively go and search and try and populate that training for you. I know there were surveys done, so we're actively working on that list as well, but it certainly helps to know, you know, what it is that's in the moment of everybody's kind of needs to access. So I'll come back to the page, keep going down. We talked about using this space as a hub, Kelly mentioned, for resources as well. So you'll see we've got some resources populated in. There is definitely a vision for this. We have more projects in partnership with NCCCC and AHI as well to advance this portal into more information, more resources, and also a place where people can go and learn about care coordination, care management careers, who the employers are, and what they need to do in order to get into that career field. So keep your eye on this space. That will be growing, developing over the next year as we build it out. If you have or know of a training resource, if your organization creates one, or if you have one and you want to share that, definitely let us know. This, again, is a community-driven platform. It's there to sort of support and help each other. So if you're a training owner, you can click here to add the training. It's a very simple short form that you fill in, populate the information. If you're not the owner, but you know or have taken a training that you think would be a great resource for others to access, please fill in the form and provide the links or the materials for that training so that we can make sure that it's hosted on here, or even reach out to the owners and create a relationship where they can create an account and start to promote their trainings for the future on here. We have a space where you can stay informed. This is where we can share updates or information when new training is added. Definitely, again, more features coming in the future that we're hoping will provide communication, connection, and again, increase the value to you as somebody who is looking for these types of resources or information. We are growing, developing, building as we go. So we're always looking for feedback and would welcome, as you do go on here, start to explore the trainings. If you notice anything odd, quirky, or you think there's some features that would be really valuable on here, we definitely ask that you please provide that feedback. As much as possible is very welcome so that we can continue to improve and enhance the product for you and ensure that it is meeting your needs directly. I'm going to scroll to the top and just do one pitch on having you also consider joining the collaborative, creating an account. It is free. That would give you access to everything in the platform, even beyond the care coordination, care management landing page. And it will allow us to sort of continue to show the value to our funders and for different projects that there is a need for this kind of tool and that it is being used. So completely free, and it will just give you more value on the tools that are in the system that you can explore as well as you come on here. So Mary, I'll have you jump back to the slides. And while Mary's doing that, there's just a couple of takeaways on the last slide, just reiterating what I've gone over here. So definitely want you to take action, access the portal, the landing page for care coordination, care management, search for trainings that you know you are in need of and looking for. If you don't see it there, please request a training. The more we can know, the more we can actively go and try and populate that. Definitely create an account, take advantage of the tool. It's free and it's going to be building and growing as well with our future vision of this product. And then give us feedback as much as possible so that we can continue to improve and advance it. And that's it. So take any questions you have. And feel free to reach out anytime with questions, even beyond this. Contact me directly.
Great. Any questions for Ashleigh? I think there'll be more to come with the HRSA workforce grant that's coming up. So that will continue the collaboration with Ashleigh and her team. So thanks very much, Ashleigh. Appreciate it. So the next thing is going to be Julia from Hixny is going to share some of the amazing work that's been done related to risk flags and other components that Hixny has worked on, which has been fabulous. So thanks, Julia. Take it away.
Thank you so much, Mary. Yep, I'm Julia Prusik. I'm the manager of product development at Hixny, and I do have to say it's just been a pleasure to work with the dedicated folks at the Care Collaborative, and I'm honored to be presenting this work to you. What I'd like to do first is start off with a poll. If you could answer in the chat how familiar you are with Hixny. And just so I can kind of know how to go through the next slides if you need a little bit of an introduction to Hixny or if you're pretty familiar already. So I'll give you just a moment for that.
We have one response so far, not familiar. Couple responses, not familiar, familiar, but to not use their services as well.
Great. So I think then I can, I'll do a little bit more in depth on who we are, and we'll take it from there. Sounds like some people look like they're familiar as well, so I won't belabor it too much.
Okay.
Great. All right. So for those of you who aren't familiar with our services, Hixny is a health information exchange. We are connected to 100% of the hospitals in our region, 78% of our physicians, and then 87% of other regulated entities. We're also connected to the State Information Network of New York, and that's called the HWNY. On the right-hand side, you can kind of see that. That allows us to connect to places like the Bronx or Rochester out west, and we can pull data from patients out there, as well as populate, data for patients that have perhaps moved from out west to here or from the city up here. And so we have a pretty broad amount of data through all of those connections. I'd like to next talk about our types of data. So predominantly, we work with clinical data. And we have a ton of clinical data right now. We're working on getting our administrative data, like claims data, added to the system. We have some right now, and we're working on getting more. And we've also been working on attaining social determinants of health data to further populate the data that we provide. We do have a little bit of patient self-reported data as well for some diabetes and hypertension control. So on the next slide, what I'd like to dive in on is our Snapshot application. So this application is what we worked on with the NCCCC predominantly. So this application has really been designed by healthcare professionals through initiatives like the one that we worked on. So we are currently, this application is available not only through our portal, if you don't have a connected EHR vendor, but it's also available right now through Cerner, Epic, and Athena. And so we're actually hoping to add additional Smart on Fire vendors to extend this capability. And right now, actually through the work of the NCCCC, it's on the roadmap for NetSmart. And this is also on the roadmap for ECW and Medent as well, if those are your EHR providers. If there's additional EHR providers that you would like us to look at in order to get our Snapshot app into their EHR, please let me know in the chats, and we can take a look at those for further development. So now I'd like to get into the actual care management risk flag that we've developed as part of the risk subgroup for the NCCCC. So we really started with the goal of identifying individuals at each facility who are at high, medium, and low risk for needing care management. Mary touched on this at the beginning. What we realized, though, was that what was most important for the folks that would be accessing this information wasn't really that the identification of high, medium, and low was, it was really specific to what made those scores high, medium, and low for each of those individuals. So we had a lot of the data that was used to calculate some of these risk scores at individual facilities. And so what we did was we kind of came up with a common way of identifying these folks and decided that we could create a centralized risk flag with all of those details underlying that could be viewed by the user in real time. So you wouldn't have to make phone calls to different care managers to see why they rated something high or why another one rated it low. We could see everything that contributed to that score right there, broken down into discrete data elements. So when we then decided where to put this data, we surveyed the individuals that were in the care collaborative. So there were 26 respondents and 85% of them used Hixny in some capacity. But a lot of them hadn't used Snapshot before this, and some of them didn't even know that Snapshot existed. So what was really valuable was that we found that while organizations may have had access to Hixny services, and they might have been participants of Hixny, the people that actually needed the access to the tools didn't have that access. And we were able, through this partnership, to get them access to this tool so that they could use the flag that we were creating here. So on the next slide, I'll show you the actual Snapshot application itself. So this is our Snapshot, and this is Sean Darcy, who is not a real person. He is our test patient, so no worries about PHI here. And what we worked on is, if you look at the top left-hand corner where Sean Darcy's patient card is, there's a care management section in the bottom left of that card. So in his case, care management is recommended, and that card can change dynamically depending on the needs of the patient. So on the next slide, I'll show you there are various different ways that this can appear. So this can appear as care management is recommended to the patient. This can appear that you may need to just consider care management if maybe, you know, all the criteria isn't met that they really need that care management, but they do have a few risk factors that they may benefit. We also have the ability to identify certain care management agencies. So for example, CDPHP, if they had a care manager at that facility, we could identify that. Mary was speaking earlier as well. We're working together with her in the Care Collaborative to try and see if we can get even more detail in that area to really identify who that care management agency is that's caring for this patient, if they are enrolled in that. And then we also have the ability to see if there are no risk flags reported. That can be there as well, so that you can, you know, check this person off your list. They're doing pretty well. So next slide. We'll go back in here, and this is kind of a mock demo, but if we had clicked into the care management section in the top left-hand corner, it would show this purple box that on the next slide that has all of the contributing factors to this risk score. So if we hover over that I at the very top of the screen, Mary, you can click to the next slide. What it shows is what is actually helping to calculate this risk score. So like I said, what we found was most important to these folks was what actually contributed to this flag of care management is recommended or care management is needed for this patient. So we worked on 2+ chronic conditions and or one plus major qualifying condition. So if they have those categories, they will be flagged for care management. If they have 2+ emergency visits within the past 6 months or 2+ inpatient visits within the past year. And then we have documented SDOH issues as they have been identified as well. So if we look at the sections below, so the enrollments, if they're enrolled in a care management agency now or in the past, those will be in there, and hopefully we can populate those a little bit better with some of the work that we're doing right now to improve that. In the enrollment section, there will also be the identification if the patient is on Medicaid. So if we know that the patient is enrolled in Medicaid services, that will be available here as well. We have our chronic conditions section and our major qualifying conditions section. Those contribute to these scores, and those will be identified there. And then Mary, if you can go to the next slide. We also have the emergency and inpatient utilization in the past year. So this is where you can see what is in the past year. This information is also available on the main snapshot page, but this really distills that information down to specifically what care managers need to identify these folks. We have social determinants of health. They're reported for these folks. And then we do have a social determinants of health referral history that is available if they have been referred for social determinant of health through Hixny's system currently. We are hoping to populate that with additional social determinant of health history referrals, but right now those are just the ones that have been created through Hixny. And I will touch on that as well. I'll just give you guys an opportunity for any questions. And while I wait for a couple minutes for questions, I'll just show you. So this is the snapshot application. While that care management is in the left-hand side, we also have the social determinants of health and referrals section on the top right, where folks can utilize that to create a social referral if needed. They can also see in the see all, it'll allow them to see that social determinant of health history if they have it, and any referrals that have been made through this Hixny platform, same as if they were in that care management link. So I don't see any questions in the chat quite yet. I can go through the Hixny social referral tool while we wait for that. So Mary, if we could just go to the next slide. And the next one after that. Okay, thank you. So if a social determinant of health referral needed to be made, you could just click into that create social referral section, which brings up this box. Here you can search for any organizations that you may know that the patient needs to be referred to specifically, or you can refer to the Care Coordination Network. I'll just jump through this one pretty quickly, but the next piece is a user attestation. So you can export a patient consent, but a verbal consent is approved for this use. And so the user just needs to attest that that patient is aware of the referral being made for them. Once the user clicks I agree, they go to just a referral details page where they can verify the patient's race and ethnicity. And then at the bottom of that section, we can go 2 slides forward. Perfect.
Julia, a question did come through the chat asking, is this available if you are a current Hixny user?
Yes, it is. So if you are a user of Hixny, or your organization is a participant of Hixny, this can be available to you. So this is accessible through our provider portal, or if you have one of the 3 EHRs that we connect with, we can certainly hook you up with that and make sure that you have access to this. So at the end of this presentation, I have a slide where you can get more details on how to connect. So we can get you set up if you're not sure if you have access or not at this time. So great. So this is the so folks can pick the service type and the subtype for those social referrals, and then they can add additional notes if they would like, to just make sure that the referral is being made to the specific organization that they want, with the information that is most pertinent to their need. All right, and then on the last screen, it's a thank you screen where you can download a referral summary. On that next slide, sorry, I'm going pretty quickly through these slides, Mary. And then if a user clicks to download the referral summary, you can click once more and it'll show exactly what that referral summary looks like with all of that information. So that can be saved to your organization, so your organization knows that a referral was made. And that's also all that information is saved within Hixny, so we have that for users as well. And so on the next slide, we have our contact us. So like I mentioned earlier, beyond the development work that we did, we realized that while organizations might have access to Hixny, many staff can benefit from our services that weren't connected. So while the organization had access, the individual care manager that needed access to be able to view that risk flag may not have had that access. So we were able to get them all access. And what we'd really like to do is make sure that you each at your facilities are identifying who needs access to Hixny, who needs access to these risk flags, and getting those folks the access that they need. And we're very happy to help you through that. So any one of these accounts or these emails here can help you get access to Hixny. And if you have any additional questions, I can leave my email as well, my personal email for the group. I'll put that in the chat. And I don't see any other questions for me, but it looks like there is one. How many organizations are currently using this database? So we have over 200 participants utilizing Hixny right now, and that is growing.
And I'll just mention, through DISRIP, one of the major initiatives was to assure that providers, both primary care, mental health, and substance use, are all connected. So most of the providers in the 9 counties that were part of DISRIP are connected to Hixny, and all the hospitals are as well. So if that helps, Susan.
Thank you so much. Great. And if you have any other questions, I've put my email in the chat for you. Thank you very much.
Great. Julia, thank you so much. Any other questions? Wait, what is this? We work for a home care organization. I think this would be a great resource to partner. Yeah, definitely. We've had several home care organizations add this for their staff. I don't know what organization you work for, but I wouldn't be surprised if your overarching organization was somehow connected to Hixny. So the question is, how do you get the people who are actually in front of the patient access? Because you store from that snapshot, if you're working with a client, that information is really powerful. So definitely reach out. Bryn. Well, anyway, I don't know. It's hard to say because it's an email address, but reach out to Julia and she can help you make sure that you can get access. All right. Any other questions for any of the panelists? Just wait for a minute. And as I'm waiting, you see the last polling question was just wanted to get a feel of what do folks think they would like to explore further of the things we talked about. So if you could just type those in the chat, but I'll make sure I watch for the, thank you. Yeah, so med management, appreciate that. Med management, yeah, that's available right now, that training. So if you go to that website that Ashleigh showed you, Ashleigh, what would be the best thing for them to type in to make sure they find it?
It should just be on that landing page, but if they just type in the name of the training, that will come up, or part of the name, it should come up in the search as well. Yeah.
Great. Yeah, I feel like trainings and the workforce issues are so critical right now that always comes up as a huge benefit. And I agree, the snapshot is awesome. You know, it's funny, years ago when Hixny was first starting, it took a long time to get people to contribute data to really make it valuable. And I always say to people, if you haven't been there in a while, make sure you go, because it's really powerful, really powerful. Nice. Oh, then Ashleigh put that in the specific link to the med management training right there. So that's great. Any other questions or thoughts, things you might look for? And if anyone's interested in partnering with us that isn't currently a partner through either the North Country CCC, the last year of that, or that HRSA workforce grant that's focused on care management, definitely reach out to one of us and we will be happy to figure that out for you. So any plans for data collection through Snapshot? Do you want to speak to that, Julian?
Absolutely. So actually the social referrals tool is the first opportunity we've had to have data collection through Snapshot. So that's direct data collection by the user in that moment. And what I'm hoping you mean, or what I'm assuming you mean, is data collection from the user. We are considering putting more data collection in there for collecting different types of information from the users. We will see. We just want to make sure that everything we put in there is extremely meaningful. I'll do a slight plug. We do have focus groups that help us work through some of these ideas to make sure that what we're developing is extremely meaningful to healthcare professionals all over the healthcare landscape. So if you have some interest, Gregory, we are more than happy to have you there, and you can reach out to me via email and I'll absolutely add you there, or anybody else that would like to contribute to some ideas that we can add here. Thank you.
Yeah, those focus groups have been very responsive. We've had discussions in those groups, and then very shortly after, you see changes to the way the product works. So they're really working on the user interface. So speak up or forever hold your peace, as they say. Make sure you say, ask for what you need. It ups your chances of getting it. So any other questions or thoughts? Here's our contact information, a little disclaimer about the HRSA grant. And we're happy to help in any way if we can get you connected.
Thank you, Mary. And just a reminder, if anyone has questions, please don't hesitate to reach out. Mary's provided her contact information. Any other questions before we wrap up? Well, thank you to Mary and the panel. This was a great presentation, great conversations. And just a reminder to all of our participants that we have 2 more sessions today at 1 o'clock and 3 o'clock, and then we have sessions tomorrow as well. Thank you for everyone who joined us today, and we look forward to seeing you at the next session.
Thank you all very much. Appreciate it. Take care.
Thanks. Bye-bye.